Welcome! Today, we're diving into the world of BMI, or body mass index. You've probably heard about BMI at the doctor's office or seen it on health websites. But what exactly is it? And how reliable is it as a measure of health? In this video, we'll break down what BMI means, how it's calculated, and whether it's truly an accurate way to assess your health. Let's start by understanding the basics of BMI and why it's so commonly used in the first place. BMI stands for Body Mass Index. It's a simple numerical value calculated from your height and weight. The formula is straightforward. Your weight in kilograms divided by your height in meters squared. This number is then used to categorize you as underweight, normal weight, overweight, or obese. The idea is to provide a quick snapshot of whether your weight is in a healthy range for your height. But is it really that simple? Let's look at how this formula came to be. The concept of BMI was first introduced in the 19th century by a Belgian mathematician named Adolphe Quetelet. He wasn't a doctor, but he wanted to find a simple way to measure the average body shape of a population. Over time, BMI became widely adopted by health professionals as a screening tool. It's important to note that BMI was never intended to be a diagnostic tool for individual health, but rather a way to look at trends in large groups of people. Let's break down the calculation. To find your BMI, you take your weight in kilograms and divide it by your height in meters squared. For example, if you weigh 70 kilograms and are 1.75 meters tall, your BMI would be 70 divided by 1.75 squared, which equals about 22.9. This number then places you into a category on the BMI scale. It's a quick calculation that doesn't require any special equipment. Once you have your BMI number, it's time to see where you fall on the BMI scale. The World Health Organization defines underweight as a BMI below 18.5, normal weight is 18.5 to 24.9, overweight is 25 to 29.9, and obese as 30 or above. These categories are used worldwide to help identify potential health risks associated with being under or overweight. But do these categories fit everyone equally? Let's explore that next. BMI is popular because it's easy to use and doesn't require expensive equipment or tests. Doctors, insurance companies, and researchers can quickly assess large groups of people and identify trends in weight-related health risks. It's also standardized, so it can be used across different countries and populations. However, its simplicity is both its strength and its weakness. While BMI is a useful screening tool, it has some important limitations. It doesn't distinguish between muscle and fat, nor does it account for bone density, age, sex, or ethnicity. For example, a very muscular person might have a high BMI but low body fat, while an older adult with little muscle might have a normal BMI but higher body fat. These factors can make BMI misleading for certain individuals. Consider athletes or bodybuilders. They often have high muscle mass, which weighs more than fat. As a result, their BMI might classify them as overweight or even obese, despite having low body fat and excellent health. This is a clear example of how BMI can sometimes fail to reflect true health status, especially in people with above-average muscle. Age is another factor that BMI doesn't take into account. As people age, they tend to lose muscle and gain fat, even if their weight stays the same. This means an older adult might have a normal BMI, but still carry excess body fat, which can increase health risks. On the other hand, younger people with more muscle might be classified as overweight by BMI standards. Men and women have different body compositions. On average, women have more body fat than men at the same BMI. However, BMI doesn't account for these differences. This means that two people with the same BMI but different genders might have very different health profiles. It's another reason why BMI should be interpreted with caution. Ethnicity can also influence how BMI relates to health. Some populations may have higher health risks at lower BMI values, while others may be healthier at higher BMIs. For example, people of Asian descent may develop health problems at lower BMI thresholds compared to people of European descent. This highlights the need for more personalized health assessments. For children and teenagers, BMI is interpreted differently. Growth patterns vary widely, so BMI percentiles are used instead of fixed categories. These percentiles compare a child's BMI to others of the same age and sex. This helps account for natural changes in body composition as kids grow, but it also means that BMI is less straightforward for younger people. Despite its limitations, BMI is still linked to health risks. Higher BMI values are associated with increased risk of conditions like heart disease, diabetes, and certain cancers. However, it's important to remember that BMI is just one piece of the puzzle. Other factors, such as diet, physical activity, and genetics, also play a major role in overall health. Some experts argue that body fat percentage is a better indicator of health than BMI. Body fat percentage measures how much of your body is made up of fat, rather than just looking at weight and height. This can give a more accurate picture of health, especially for athletes or people with unusual body compositions. Besides BMI and body fat percentage, there are other ways to assess health. Waist circumference, waist to hip ratio, and even blood tests can provide valuable information about your health risks. These measurements can help paint a fuller picture of your overall health beyond what BMI alone can tell you. Doctors often use BMI as a starting point for health assessments. It's a quick way to flag potential issues, but it's rarely the only measure they use. Most healthcare providers will look at your BMI alongside other factors, such as your medical history, lifestyle, and family background, to get a more complete understanding of your health. On a larger scale, BMI is useful for public health research. It helps governments and organizations track trends in obesity and related health problems. By looking at BMI data across populations, researchers can identify areas where interventions are needed and monitor the effectiveness of public health campaigns. Insurance companies often use BMI to assess risk and set premiums. People with higher BMIs may face higher insurance costs as they're considered at greater risk for certain health conditions. This practice is controversial as it can penalize people who are healthy but have a high BMI due to muscle or other factors. Unfortunately, BMI can also contribute to weight stigma. People with higher BMIs may face discrimination or negative assumptions about their health, even if they're otherwise healthy. This can impact mental health and discourage people from seeking medical care. It's important to remember that health is complex and can't be reduced to a single number. The focus on BMI can sometimes lead to anxiety or unhealthy behaviors, especially if people feel pressured to fit into a certain category. It's important to approach health holistically, considering mental and emotional well-being alongside physical health. Remember, a healthy body comes in many shapes and sizes. BMI is often used in diet culture to promote weight loss products or programs. However, focusing solely on BMI can lead to unhealthy dieting or body image issues. It's more important to focus on healthy habits, such as balanced eating and regular activity, rather than chasing a specific BMI number. Fitness professionals may use BMI as a starting point, but they often rely on other measurements, like body fat percentage or fitness tests, to assess progress. Remember, being fit doesn't always mean having a low BMI. Strength, endurance, and flexibility are also important indicators of health. Research shows that higher BMI is linked to increased risk of chronic diseases like type 2 diabetes, heart disease, and some cancers. However, not everyone with a high BMI will develop these conditions, and some people with a normal BMI may still be at risk. It's important to look at the whole picture, including lifestyle and family history. Some studies suggest that both very low and very high BMIs are associated with increased risk of death. However, the relationship is complex, and many other factors influence longevity. BMI is just one piece of the puzzle, and it shouldn't be the only factor considered when assessing health risks. Genetics play a significant role in body weight and composition. Some people may have a higher or lower BMI due to genetic factors, regardless of their lifestyle. This means that BMI alone can't capture the full complexity of an individual's health or risk factors. Lifestyle factors like diet, exercise, sleep, and stress all impact health, sometimes more than BMI. Someone with a higher BMI who eats well and exercises regularly may be healthier than someone with a normal BMI but poor habits. It's important to focus on healthy behaviors, not just numbers. Certain medical conditions can affect BMI. For example, people with thyroid disorders or hormonal imbalances may gain or lose weight unexpectedly. Medications can also influence weight. This is another reason why BMI should be interpreted in context, not in isolation. During pregnancy, BMI is not a reliable measure of health. Weight gain is a normal and necessary part of pregnancy, and BMI categories don't apply in the same way. Doctors use other methods to monitor health during pregnancy, focusing on the well-being of both mother and baby. BMI can sometimes be used to diagnose eating disorders, but it's not the only factor. Mental health professionals look at a range of symptoms and behaviors, not just weight or BMI. It's important to approach eating disorders with sensitivity and a comprehensive assessment. Athletes often have higher BMIs due to increased muscle mass. For example, football players or weightlifters may be classified as overweight or obese by BMI, even though they are in excellent physical condition. This shows that BMI doesn't always reflect fitness or athletic performance. For older adults, BMI may not be as accurate. Seniors often lose muscle and bone mass, which can lower their BMI even if they have more body fat. Some research suggests that a slightly higher BMI may actually be protective in older age, highlighting the need for individualized assessments. Children's bodies change rapidly as they grow, so BMI is interpreted using age and sex-specific percentile. Pediatricians use these percentiles to track growth patterns and identify potential health concern. However, BMI is just one tool among many used to monitor children's health. Focusing too much on BMI can negatively impact body image and self-esteem. It's important to remember that health is about more than just numbers. Embracing body diversity and focusing on healthy habits can lead to better physical and mental well-being. With the rise of health apps and wearable technology, BMI calculators are now widely available. While these tools can be helpful, it's important to use them as a starting point, not the final word on your health. Always consult with a healthcare professional for a complete assessment. Globally, BMI is used to monitor trends in obesity and undernutrition. This helps organizations like the World Health Organization track progress and identify areas in need of intervention. However, cultural and genetic differences mean that BMI cutoffs may not be appropriate for every population. Researchers use BMI in studies to analyze the relationship between weight and health outcomes. While it's a useful tool for large-scale studies, it's less reliable for individual assessments. Researchers are increasingly looking for better ways to measure health and risk. As our understanding of health evolves, new tools and measurements are being developed to provide a more complete picture. These may include genetic testing, advanced imaging, and personalized health assessments. BMI will likely remain a useful tool, but it will be just one part of a much larger toolkit. BMI can help identify people who may benefit from preventive care, such as nutrition counseling or exercise programs. Early intervention can reduce the risk of chronic diseases and improve quality of life. However, it's important to use BMI alongside other health indicators for the best results. Educating people about the strengths and limitations of BMI can help them make informed decisions about their health. Understanding that BMI is just one measure can reduce anxiety and encourage a more balanced approach to wellness. Governments and health organizations use BMI data to shape health policies and allocate resources. While it's a useful tool for planning, it's important that policies also consider other health indicators and the unique needs of different populations. Social media often promotes certain body types as ideal, sometimes using BMI as a benchmark. This can create unrealistic expectations and pressure to achieve a specific number. It's important to remember that health and beauty come in many forms, and BMI is not the ultimate standard. Many people use online calculators to check their BMI at home. While this can be a helpful starting point, it's important not to rely solely on BMI for health decisions. Consulting with a healthcare professional provides a more accurate and personalized assessment. When discussing health with friends, family, or healthcare providers, it's helpful to remember that BMI is just one part of the conversation. Focusing on overall well-being, including mental, emotional, and physical health, leads to better outcomes and a more supportive environment. So, is BMI accurate? The answer is, it depends. BMI is a useful tool for identifying trends and potential health risks, but it has significant limitations. It doesn't account for muscle, bone, age, sex, or ethnicity, and it shouldn't be used as the sole measure of health. Always consider the bigger picture and consult with healthcare professionals for personalized advice. In summary, BMI is a quick and easy way to assess weight relative to height, but it's far from perfect. It's best used as a general guide, not a definitive measure of health. Remember to focus on healthy habits, listen to your body, and seek professional advice when needed. Health is complex, and everyone's journey is unique.